a competent adult should be able to make that decision for themselves. I think that how we die is also a part of how we live. I think that we have very important autonomy interests and interest in our own bodily integrity that would be advanced by recognizing a legal right to assisted suicide and voluntary euthanasia for competent adults.
Larry, you want to come back at that?
Well, what about depression, though? Does depression make somebody incompetent, Joan? I mean, that's the nuance here.
There are legal tests for whether somebody is competent or decisionally capable, right? And it is not the case that everybody who's depressed is not decisionally capable.
No, exactly.
We all know too many people who are depressed that we don't think they're decisionally incapable.
We don't treat depression by killing the depressed patient. So we try, what's behind this?
No, but I think you were suggesting that you should take away decision-making rights from somebody who's depressed.
No, I'm not saying that. I'm just saying that killing a depressed patient is not the best outcome in this situation. Somebody wants an overdose of barbiturates, which is a form of suicide. Prescribing that, agreeing that they have a life not worth living, isn't what physicians should be doing. This person should have their depression assessed and treated.
If that depressed patient was maintained on a ventilator and refused the ventilator and said you must remove it, as a physician, you would follow. And I assume that you would talk about the depression, and I'm assuming you would look into it. And I'm assuming that if the patient still maintained her insistence that she did not want to be maintained on a ventilator, that you would accede and assist in that request.
But that's a category mistake. Somebody who's on a ventilator is in a different position than somebody who's not on a ventilator. Being kept alive by technology is a very different category ethically than just being ill.